The NIHR Research Unit on Health and Fragility is looking at how situations like conflict and displacement affect a country's capacity to offer effective health services.
We're really proud to be working with researchers from Queen Margaret University, from the Global Health Institute at the American University Beirut, and from the College of Medicine and Allied Health Sciences in Sierra Leone to be developing methodologies that are really well suited to researching in these challenging environments.
En el caso de las muertes por enfermedades no transmisibles, a la cabeza tenemos las enfermedades cardiovasculares, donde pasamos de una tasa de 132 a 145. Otra de las enfermedades que nos está afectando considerablemente es la diabetes mellitus. Y en tercer lugar tenemos la mortalidad por enfermedad renal crónica.
Stress and lifestyle changes caused by displacement of population increase the risk of many diseases such as diabetes, hypertension, and cancer. In the case of the Syrian refugee crisis, these diseases are not only high among the refugee population but also in the host community, putting enormous strains on the Lebanese healthcare system.
NCDs and mental health are some of the areas in which we do not have sufficient data. So if we do not know the number of cases of people with mental disorders or the number of cases of people with diabetes and hypertension, we cannot provide them with adequate medical assistance.
Ya tengo 12 años de padecer diabetes y he tenido bastantes complicaciones. A mí el año pasado me abrieron planta de estropié, pues me ensarté una espina. Ahora resulta que en un hierro trabajando. Y de ahí perdí mi dedo, pero igual nunca me detiene. Yo sé que tengo que trabajar, tengo mis hijos.
I believe there should be a holistic approach to handle NCD, either regarding the coordination between NGOs and the university.
Research should be aligned with national priorities and how it should aim at strengthening systems, especially in context of fragility.
So what we have done as a ministry is to prioritize the non-communicable diseases, and of course try to see how we can work with our partners to harmonize our training manual so that we are able to give the same information, the same training to our healthcare providers, so they're able to provide evidence-based services to our beneficiaries.
Esta innovación investigativa de parte de la Universidad Queen Margaret sería también un paso inicial para poder incidir en otros elementos que también generan enfermedades crónicas no transmisibles.
Throughout our work, we're particularly committed at working with local communities, working with health providers, as well as ministries of health, to develop a whole-of-system approach to addressing the challenges of delivering quality health services in these environments.